Good afternoon, everyone. Welcome to a very special episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. April is Child Abuse Prevention and Sexual Assault Month. Today, we are featuring the Our Kids Center. Thank you for joining us. My name is Kathy Poole.
Hello, everyone. I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Joining us today is Dr. Lisa Milam, a forensic social worker with Our Kids, a one-of-a-kind facility which was founded by the Junior League of Nashville, Nashville General Hospital, and Vanderbilt University in 1987. Our Kids provides expert medical evaluations and crisis counseling in response to concerns of child sexual abuse.
Dr. Milam is Director of Expansion at Our Kids and has successfully launched 4 satellite clinics in child advocacy centers in rural areas of Middle Tennessee. In her 30 years with Our Kids, Lisa has participated in the evaluation of more than 10,000 children. In addition to collecting a medical history from children who present for evaluation, Lisa also provides forensic assessments for more complex cases involving young children. Lisa has presented at numerous professional conferences in Tennessee, across the country, and has published research related to how children recall information, how children report experiences of genital touching, and how historical information from children correlates to physical exam findings. Everyone, please welcome Dr. Milam.
All right. And I'm going to share my screen with a PowerPoint. Is that okay right now? All right. Thanks for having me today. I'll go through just a little bit of a presentation, but certainly if there are questions, I assume that Kathy or Kaylin will sort of interrupt and let me know. But the Our Kids Center, we are an outpatient clinic of Nashville General Hospital. I often tell people I think we're the best kept secret in Nashville. Sometimes we serve more than just Nashville. We serve all of Middle Tennessee. Just to give you an idea of the services we offer, we do the forensic medical exam. It's important to understand that that exam, anytime there's a concern that a child has been a victim of sexual abuse, there are healthcare needs that have to be addressed. At the same time, there are concerns about an investigation. By law, all reports or concerns of child sexual abuse have to be reported to the Department of Children's Services and/or to law enforcement. So the medical exam, when that's conducted, we have to be sensitive to the investigative needs as well. So it is a forensic medical exam that assesses or that addresses both healthcare needs first and evidence collection when needed and when appropriate. Again, we're an outpatient clinic of Nashville General Hospital, but we serve over 45 counties in Middle Tennessee. We see around 900 kids a year. We have medical staff, nurse practitioners, as well as clinical social workers who are available to every family, and each family receives care from both a social worker and a nurse practitioner. We're available 24 hours a day, and we typically see kids from birth to age 15. We see kids 16 and 17-year-old as well, but it just depends on the circumstances, and there are different things that determine when we see certain kids, and I'll talk more about that in a minute. It's also important to note that there is no cost to families. No child or family is ever billed for any service that we provide here at the Our Kids Center. We have a number of different facilities. We have our main clinic here in Nashville, which is at 1804 Hayes Street. We also see kids at Nashville General Hospital in the emergency department, as well as at Vanderbilt Children's Hospital at times. But then we also have satellite clinics, as I think Kaylin mentioned earlier. We have satellite clinics in Cookeville, Tennessee, which is to the east. We have a satellite clinic in Lawrenceburg, which is to the south of Davidson County. We also have a satellite clinic in Clarksville and a satellite clinic in Manchester. And we see those, or we staff those clinics 2 days each month, and see probably about anywhere from 60 or 70 up to 100 kids a year in those clinics. We work typically with the Department of Children's Services as well as law enforcement. We work with, again, healthcare providers from Nashville General Hospital as well as Vanderbilt Children's Hospital, and then just lots and lots of different local providers, pediatric practices, and other hospitals. We also work with the district attorney's office, not just in Nashville, but in many of the surrounding counties as well. We have, at this point in time, a lot of people are familiar with the term trauma-informed care. We have been a trauma-informed practice pretty much since the beginning of the Our Kids Center back in the 80s. We are actively involved in teaching and training other residents, nurses, healthcare providers from across the country in how to do these exams. We often provide testimony, expert testimony in court, and we also continue to actively conduct research and publish research. We also participate on something called the CPIT team, which is the Child Protective Investigative Team. Every referral to the Department of Children's Services that requires an investigation, by law, that investigation has to involve the Child Protective Services staff from the state, as well as local law enforcement, district attorney's office, and child advocacy centers. We are a consultant to that team when they have questions regarding health issues or even evidence collection issues, those kinds of things. Then we provide expert consultation to them to help them, manage cases and know when and where to get kids referred for healthcare, whether it's to us or another healthcare facility. The majority of our referrals do come from the Department of Children's Services, although that is changing. More and more and more of our referrals are coming from healthcare providers, private practitioners, as well as other emergency facilities. We're seeing a pretty significant increase in referrals from healthcare providers. But again, the majority do come from DCS. Some come from law enforcement, and some come from other places. Either a family finds our service or accessed our service online, or they hear about us another way. There's no requirement for DCS or law enforcement to be involved in order for a child to be seen by the Our Kids Center. Parents can self-refer. We do see kids sometimes that have no DCS involvement. For example, some children who may require just pediatric GYN care, because we are so accustomed to looking at a child's genital area. There may be issues or things that we are familiar with and can help address that are not easily addressed in other places. So we also provide services that may not be related to any kind of investigative effort. Families have questions. Let me go back to that screen. A lot of family members sometimes call just with questions. They're not sure what to do when they have a child who may have sexual behaviors, or a child who may have a genital injury, or something related to a question about whether a child needs our services. And we certainly can provide consultation and talk with those families, either on the phone or in person. It's not uncommon for a family to come in and the child once we talk with the family, there's a decision made that the child doesn't need an exam. So again, we get referrals from a variety of places. When we think about trauma-informed care and what that means, generally what it means is that we're very aware when a family comes into our facility, that there's lots of emotions involved. If there's a concern of sexual abuse, we make sure we're very transparent with families, that they understand exactly what we're going to be doing, how we share information, and we are required by law. Any healthcare provider is required by law to share information with investigative authorities anytime they're examining a child when there's a concern of child abuse. Often people think that we work for the district attorney's office or for the police department, and that is simply not the case. We are a healthcare facility, but the law says that we do have to share our information with those investigative agencies. So we make sure that parents understand that. We make sure that parents and children know exactly what we're going to do in terms of the exam process here. Ultimately, parents, and children have a lot of say in what goes on here. There are times where we may need to see children if a parent is not able to be here or not willing to be here. But by and large, parents are here and they are actively involved in the care that we provide for their children. Children are also involved in that care. We let families and kids know what's going to happen after their visit here. We do a lot of exam preparation with kids so that kids know what's going to happen during the exam. We spend a lot of time with families. This is not a short 15 or 20 or 30-minute medical visit. This is typically a couple of hours that a family may be here with a child. In terms of which children need an exam from us, and again, there are exceptions to every rule, but as a general rule, if there's a concern of sexual abuse of a child, and that child is describing some type of sexual contact that involved penetration of their body, it involved oral contact or contact with the genitalia of another person, then those children typically need to be referred for an exam. Kids who are not verbal for whatever reason, either because of age or developmental delay, who aren't able to necessarily tell what's happened to them, may need to be referred for exam. Certainly children who have symptoms that are concerning for an STD need to be referred for exam. Children where there's a concern or any evidence that they may have sustained an injury at the time of the assault or the alleged assault will need to be referred for an exam. And again, it's just really important to understand that child sexual abuse is obviously an issue that requires an investigation from Child Protective Services and law enforcement, but it also has significant consequences for health and wellness, whether that's related to injury, sexually transmitted diseases and infections, or a child's emotional needs. There are lots of things that go into this exam, and again, this is a healthcare facility first, primary. We're available 24 hours a day, 7 days a week, 365 days a year. The vast majority of children are seen non-emergently. In other words, what we know about child sexual abuse is that most kids don't report immediately. And so the majority of exams we see are kids who are talking about something that may have happened, whether it's a week ago or 3 weeks ago, or even 6 months ago or 2 years ago or something. The allegations of sexual abuse in children are very, very different than allegations of sexual assault involving adults. Often people think about us being sort of the same as a rape crisis center. It is not the same at all. There are very, very different dynamics related to child sexual abuse. In terms of what makes something an emergency, if there's an alleged sexual assault or contact that occurred within the last 3 to 5 days, typically that's going to require an emergency exam. There are things we can do in those first 3 to 5 days that we're less able or not able to do after that 3 to 5 days. If there's a history of recent bleeding or injury, then that's going to likely require an emergency exam. All we ask is that people contact us first so that we can talk with whomever by phone and help us. It allows us to make the best possible decision. There are some kids that may need to come to our office for an exam. There are some kids that may need to be seen at one of our hospitals, whether that's General Hospital or Nashville or Vanderbilt Children's Hospital. It just depends on everything from what's happened to when it happened to the age of the child. There are lots and lots of things that go into that decision. So we always encourage people to make sure that you contact us first before you just show up at our hospital or at our facility. We're very easy to get a hold of. I think we're actually the easiest people in Nashville to get a hold of. And I'll make sure that our contact information is up here on the last slide, I think. And again, as I noted earlier, all families will see both a medical and a mental health provider. Whenever a family arrives here, the first thing we do is sit down with that caretaker, that parent or caretaker in private, to talk with them about what's going on, what brings them to the clinic, what their needs are, what their concerns are. After that, the social worker will sit down and do exam preparation with the child. Most children have not had any kind of genital exam prior to their visit with us. And so we want to make sure that kids can see the exam room, can see the equipment we use, and understand that there's nothing painful that we're going to be doing. Most kids, once they find out they don't have to have a shot, most kids are fine here. Parents tend to be really concerned that kids are going to have a negative reaction to having a genital exam. And in reality, kids are worried about getting a shot is what they're worried about. For children over the age of 5, we're going to collect a medical history from that child, which means we're going to sit down with that child privately without the parent present and get some information from them. Everything from, is anything hurting them today? Do they take any medicines? All kinds of things related to their health, including questions about what may have happened that's caused a concern for sexual abuse. This is not the same as a forensic interview that might be done as part of the investigation. Just think about your normal trip to a healthcare provider. That provider is going to ask you some questions about what's going on that brings you there and what your concerns are. And that's what we're doing with children, but we have to do it in a way that allows for them to share accurate information to the extent possible. There are some kids, again, depending on age or developmental impairments, that may not be able to provide information. We will also sit down with the parent, the social worker, and the medical provider to talk about follow-up, as well as what information we may have discovered here during an exam or during an interview with a child. Again, visits here last anywhere from 1.5 to 2 to 3 hours, just depending on the situation. Like I said, there are no needles. This is not the exam that most adults or even teenagers will have when you go for a GYN care. We don't use a speculum. Now, there are some teenagers that, if that's needed for healthcare, obviously we would do that, but the vast majority of children, we have no need to use a speculum or anything like that goes inside a child's body. We do documentation, just a medical report, which again, by law, we have to provide to either DCS and or law enforcement investigators. We're a really kid-friendly place. In fact, again, parents worry about their kids coming here. One of the biggest problems we have is getting kids to leave here because they just want to play. They want to hang out. We have a facility puppy. It's not a puppy. She's a dog. Her name is Desi. She tends to be more useful with adults than kids. Kids love Desi and they love to sort of hang out with Desi, but there's something about Desi that even for adults, they just sort of melt and emotions just sort of, you can just see them come down the minute Desi prances into a room. If families don't want to interact with Desi, they certainly don't have to. But again, it's a very kid-friendly environment, whether it's toys or a fish tank or the puppy or just hanging out with some of our staff kids. It sometimes is a challenge for parents to get their kids out the door once an exam is done. There's another picture of Desi. I don't know why she looks sad all the time. She's not a sad puppy at all, but to me, she always looks like she's kind of sad, but she's not. Like I said, we do a fair bit of pre-exam preparation with kids. You can see this is just a regular exam table. This is something called a colposcope. Doesn't ever touch a child's body. It just allows us to look in a way that we can magnify. You can see when we look through these eyepieces here, there's a light that's shining on a child's body. It just magnifies the things that we're able to see. There are a couple of monitors in the room here. We take images. There are a lot of reasons we take images. The images are not, they're not available we don't send out images of kids to investigators. I mean, in order to get a copy of any image we take here, it requires a subpoena from a court. I honestly can't even remember the last time that we had a subpoena for images. It just rarely happens. Our primary reason for taking images is to document what we're seeing and for something called peer review. We want to make sure that we maintain a certain standard of care and a high standard or high level of excellent care. And so the images, the medical practitioners sit down with each other, and every child's exam is reviewed to make sure that we're calling things correctly and that we're maintaining a high level of care and evidence-based practice. We do testing for STDs. We also will provide prophylaxis for kids where there's been an exposure. And there are some STDs that we can, again, offer preventative medication. And that's something that's discussed with the family and with the child when they're here. And again, all those decisions are made based on what's happened, when it happened, who's involved, all those kinds of things. And again, the entire exam process is documented in a way that allows it to be used for whatever investigative purposes. There's just no way to separate out that an assault, a sexual assault on a child creates both health risk as well as a need for evidence collection. And so the Our Kids Center was created to be able to do both of those things in a way that is trauma informed, and ultimately the child comes first. If it comes down to a child's health or evidence, the child's health wins every time. And we have to make sure that we always keep that child's health as our primary concern. Again, this exam is not traumatic. I can't say enough that it's the shot when kids walk into a doctor's office. Think about your own children. First thing you hear when they go to the doctor is, am I going to get a shot? We don't forcibly restrain kids. If kids are not able to tolerate or manage the exam in a way that's appropriate or healthy for them, we're not going to restrain kids. Again, we don't typically use speculums, and probably 99% of kids who come here do really well with the exam. There are some kids that, for any number of reasons, are not able to do it, and that's okay. We either don't do the exam at all, or we allow for them to come back another time when they're more able to do it. But the vast majority of kids do just fine here. One of the things that's important to understand is that most kids do not have injuries from a sexual assault. Only about, we say 7% of the time will we find an actual injury. Now, when we see children more immediately within the first 5 to 7 days after an assault has occurred, then about 25 to 30% of the time we may well see an injury. And those are genital injuries. Now, when we talk about kids who sustain a sexual assault that involves penetration of their bottom or their anal area, those injuries occur even less often. So the most important thing for child sexual abuse is what that child is saying. The exam is important for all kinds of reasons, but in terms of determining whether or not a sexual assault actually occurred, that comes down to what a child is saying. And the child's statement about that is by far the most important piece of information when making a decision or trying to determine whether a sexual assault occurred. Again, the exam is important just for medical care, health care. We often see other health issues that need to be addressed. It's important for treatment of STDs. Sometimes we have kids who may be pregnant, and that's something that has to be addressed. It's important to document any evidence that may be needed for an investigation. We're treating injuries, making referrals for other kinds of treatment, and then also just reassuring that child and the family that the child is okay and that there's nothing wrong with their bodies, that they're not damaged. We've all sort of grown up in this world where we think that, that a sexual assault in some way damages or injures forever, a child's body. And that is so not true on so many levels. And so we spend a fair bit of time helping families work through that as well. Again, we like puppy dogs. Call us if you have a question or a concern and think that you need our services. We are, again, easy to get a hold of, available 24/7. Don't ever hesitate to call us. So if there are any questions, I'm happy to take questions. That was a really quick, brief overview, but I hope it gives you some information about what's available at Nashville General Hospital. Again, most people don't realize that General Hospital has a clinic like this, and we are one of the very few clinics of our kind in the country. There's really no clinic like us in the country. There are some others that do similar things that we do, but we're pretty unique, and we're very proud to be associated with Nashville General Hospital. We couldn't exist without Nashville General Hospital. We can't say that enough. My boss, our executive director, Dr. Sue Fort White, we take every opportunity we can to make sure that the people of Nashville know that you have quite a cool thing here in Nashville that General Hospital offers, and we couldn't do it without Nashville General Hospital. So thanks. I'll stop the. You want me to? I'm sorry. Let me ask. Do y'all want me to leave this up here, or?
You can stop sharing. We will provide everyone with your contact information afterwards.
All right, thank you. Okay.
No, thank you. Thank you very much, Lisa, for that wonderful presentation on our kids and all of the services that you all have available. And I want to know, and anyone that's currently viewing this broadcast live, please know that you can ask questions for Lisa, either privately by messaging Nashville General Hospital's Facebook account, or you can message in the chat publicly. But please send in any questions that you have for Lisa. This is definitely a great time, and to have a resource such as herself here and available. But while we wait on questions to come in, I do have a few questions myself, Lisa, based on some of the information that you shared. So, and please forgive me because it may even be a refresher. So when you discuss, the exams and the processes that you all go through when it comes to when a child comes in and the examinations that you all do, and you say that the biggest thing is what the child says and their conversation in that. So I guess I want to know, I don't have any children myself, but I have younger cousins. I have, younger family members, friends that have children. So are there any trainings or resources that you would advise, or that you would recommend, that maybe even our kids provides to adults so that they can pick up on those telltale signs? Because I know, for instance, barbers and hairdressers, there's this new policy where, they go through a certain training now to recognize domestic assault if they have a client come in. So are there any resources that you recommend, or anything that our kids provide that would, like, those telltale signs that someone can recognize?
I think there are a couple of things, and our website is available as well, ourkidscenter.com. You can message us on that. We also have a lot of information on that website. There's also a website, whatifitoldyu.com, that has links to all kinds of resources. No matter where you are in the country, you can find a link to a local resource. In terms of training, and I love that you asked that question, because one of the things that we finally, it's taken a long time, and I've been around for about 30 years here. I've been around for about 35 years in just the investigative world prior to coming to healthcare. We've really moved from the idea of kids protecting themselves, that it really is the adult's job to protect kids. And to that end, child advocacy centers, which are located in every judicial district in Tennessee, have a really cool program called Darkness to Light. And it's a training program that's specifically designed for adults to begin to recognize when kids may be either in vulnerable situations or at-risk situations, as well as how to respond to kids. And the first thing that we would say to parents is, talk to your kids. Let them know that it's okay to tell if anyone ever touches their private parts, or whatever word you're using for genitalia. And that if your child ever does tell you, the very first thing you can do is just remain calm. Let them know that you're glad they told, that it's okay, and that they're not in any trouble and they haven't done anything wrong. And then find a private way to get on the phone with either the Our Kids Center or your local child advocacy center and talk with us about sort of what to do next. That remaining calm, letting your kid know that it's okay to tell. Those are really the most basic of things that you can do. Give them names for their private parts, and let them know it's okay to tell you. So those are the sort of short answers to that question.
Well, thank you. Thank you, Lisa. And we actually had a question that came in through Facebook Live. And this question asks, do you all provide Nashville General's frontline workers any training or resources in regards to handling these sensitive issues?
We do. We provide regular training. It actually hasn't been that long since we provided some training to the emergency department at Nashville General Hospital. We have such a close working relationship with them that honestly, it's more ongoing training than it is anything else, because we just regularly interact with everyone from the hospital operators to the emergency department to the lab personnel, medical records, IT. I mean, we just have pretty regular contact with all of them, but we do also offer regular trainings.
And I guess while we're sticking to the conversation of training and resources, so are there any volunteer opportunities available for, like, if someone just wanted to come and volunteer and assist, or are there any ways that someone can provide resources to our kids? And even if someone wants to go into the social, if any of our viewers is planning to go into social work and wants to be able to be there and be able to be a resource and help, is there anything available for those individuals?
We have lots and lots of volunteer options. And again, our website, ourkidscenter.com, we have several fundraising events. Even though we are an outpatient clinic of Nashville General Hospital, we're actually a public-private partnership, so that we're also a 501c3, which means that while some of our funding comes through the hospital, more than half of our funding is money that's raised on our own through our 501c3. And so we have fundraisers throughout the year that are heavily, heavily volunteer driven. So we encourage anyone who's interested in volunteering to go to our website, and there'll be all kinds of opportunities, whether it's specific fundraisers, board participation, marketing. There's just lots and lots of different opportunities to volunteer. As far as students, we often, in fact, I've got a graduate student intern right now. So it is not uncommon for us to have students who come through here for a field placement or an internship. Again, we train Vanderbilt residents, pediatric residents, Belmont, TSU, I think other nursing school, Vanderbilt nursing school students. There's just a wide range of learners that come through here. We're actually a skills lab site for Indian Health Services. And so nurse practitioners, physicians, healthcare providers from all across the country who are in Indian country serving Native American populations come through here to learn how to do this exam. And we also participate in peer review with them to help them be able to provide the best possible service they can for Indian country.
Lisa, how has online issues affected the Our Kids Center? Have you seen more of an uptick in a certain age group because there's so many online predators?
There is no question that the popularity and the sort of integration of that into just daily, everyday society for kids has created a significant risk for, and I wish I could tell you it's teenagers, but it's all ages. And yeah, we have seen an increase in kids that either they think they're communicating with someone who they know, and it turns out to be, instead of a 14-year-old, at another school in town, it turns out to be a 37-year-old from Toronto. And yeah, it's what I've come to say to every parent that I encounter is, when you hand your child that electronic device, whether it's a cell phone, a tablet, an Xbox, whatever it is, you have to understand you're giving every sex offender in the world 24-hour access to your child. And you're giving your child 24-hour access to pornography. And if you think your child is not looking at that stuff, and if you think your child is not being approached by people seeking to harm them, you're just wrong. And I hate to be that brutal, but you're living in fantasy land if you think that that's not happening. The other thing that kids are doing, and again, you're in fantasy land if you think they're not doing it, is sending and receiving images of their peers and themselves. that parents, every parent that I talk to swears, oh, my child would never. Well, if your child is a normal, well, healthy, functioning kid, then absolutely they will. I mean, that's just life right now, is that, I mean, truly, if kids are acting normally, they are sending and receiving images that are sexual in nature of themselves and of their peers. And you have to know that, and you need to give your kids information that what they see online, for one, sexual stuff online is not real. Those are actors. It's not sex, what sex is like. You need to be giving your kids information. And again, on our website, we've got some specific resources for how to manage online safety. But yes, we have seen an increase in kids who are being exploited because someone online has in some way manipulated them into a meeting or some sort of relationship.
And the numbers are staggering. I mean, it's 1 in 4 girls and 1 in 7 boys.
Correct. It will be a victim of sexual abuse by age 18. That's correct.
Right. And then how do demographics play into it? Has it been, Nashville has such a booming Hispanic population, Kurdish population. I mean, is there outreach into those areas, underserved areas?
There is outreach for every population. The thing about sexual abuse is that it really isn't connected to socioeconomic status or race or anything like that. It's interesting that it's different, cultures are different, and yet it's really all the same. I mean, cultures have shame around it. They have sort of their own beliefs, some of which are true, some of which may not be true. And families, how families and people react to it in terms of the shame and the fear and the guilt. And that's pretty much true for every culture and every socioeconomic background. Physical abuse and neglect, you do tend to see increases, based on whether it's related to poverty or substance abuse. With sexual abuse, that's just not the case. It cuts across every demographic that you can possibly imagine. The issue is whether or not families are comfortable, or the degree to which a family or a culture is comfortable or willing and able to come forward, whether there's a speech barrier, language barrier that prevents them from being able to share that information, whether there's fear related to, immigration status that may prevent them from sharing that. But yeah, I mean, it's not unique to one particular demographic.
And most children know their abusers, correct?
Correct, the vast majority. The idea of stranger danger, I'm not opposed to stranger danger teaching, but honestly, that we rarely see kids where the alleged perpetrator is a stranger, other than, again, define stranger. And we have a 13-year-old who's been talking to somebody online for 6 months. Well, they don't consider that person a stranger. Yeah, we do, particularly when they think that's a 14-year-old kid and it turns out to be a 30-year-old man. So how do you define stranger? But the idea of, and I saw a news story about a child abducted recently, I forget where from, and I know that every parent sort of has that, oh my gosh, that's what you had to protect from. And I'm not downplaying that or minimizing that, but if those were the only kids that we needed to serve, you wouldn't have a need for us. I mean, that's just that simple. 97% of kids or more are sexually assaulted by someone known and trusted in the family.
So during the holidays, is that a uptick period, for lack of a better word?
Actually, there are a couple of holidays where we do see, there are a couple of holidays where we do see an increase. And it's not, it's not always, it's not constant, but yeah, it's clear that things that bring groups of people together certainly create a higher risk for kids.
Because I know that to that point, I know there were also a lot of reports that during the pandemic, when more parents and families were at home more and everyone was, quote unquote, spending more time together, there was an uptick in domestic abuse. Was there also, I guess, in these last 2 years since we've been in this pandemic, since 2020, have you seen also that also correlated to child sexual abuse, or have the numbers pretty?
I think we don't know yet, because one of the problems we had during the pandemic was that kids were home with people that may well hurt them, but they were also not able to be out and tell anyone. And so we expect to be able to answer that question in the next 1 to 2 years, because while, yeah, kids were at an increased vulnerability, there was no way for that to be known. And so I think the jury's still out on how the pandemic affected that. I think the jury's still out.
And we have one more question that came in through Facebook. So I know earlier you mentioned, when parents in the conversation, or how, I guess, any training or resources of how to notice the signs and symptoms of child sexual abuse. But the question is, what's one common mistake that parents make when handling these sort of issues? And then also, what's one tip or key takeaway that you want to give parents about these situations?
I think I'm actually going to give you two. They're sort of the same one, but the first one is, and everybody says it, we all say it. Whenever we're talking to our kids, we say, don't let anybody touch your private parts. You have to remember that a 3-year-old or a 7-year-old or even a 12-year-old can't stop someone from doing it. You want to tell them it's okay to say no, but when you say don't let anybody, and then it happens, now you've got a child who's already in that mindset of, I've let something happen that I shouldn't have let happen. So instead of saying that, just again, communicate, because what you really want as a parent, you want your child to come and tell you if it happens. So just come and tell me if it happens. And then the second thing is, if that child comes and tells you, there's a lot of emotion in that. Find a place of calm, because when parents react with strong emotion, whether it's anger, despair, that affects a child's ability to communicate their experience. And even those things that seem protective, like, I'm going to kill whoever did. Yeah, that's the last thing that a child wants, is uncle whoever, or sister, or aunt, or grandpa, or dad to be killed. And kids believe parents when they say that. So be mindful of what you say, and be intentional. When a child makes that report, or if a child makes that report, okay, I'm glad you told me, and you're not in any trouble, and you haven't done anything wrong. Those are the things I would say first, are the most important things. Let your child know it's okay to tell, and then listen when they do.
Well, thank you, Lisa. And I just have one final question. So are there any, for lack of a better word, words of comfort, or any, because there are children whose story didn't get shared. There are children who whose parents didn't believe them, or unfortunately weren't able to find a resource like you. And those children are now young adults and they have children of their own, or grandparents even, at this time in their lives. So is there any, I guess, word of comfort or anything that you would say to those individuals that may be viewing today?
I would say almost the same thing, to remember whatever happened was not your fault, and you didn't do anything wrong. And that child you was an innocent child, is still an innocent child, and that the adult you are now can begin to do things to take care of that child that parents or caretakers failed to do for whatever reason, whether they were unable or unwilling. Most parents do the best they can, and yet sometimes they still fall short. And that it's okay to recognize that your parent didn't or wasn't able to do what you needed. But now you get to do it for yourself. And there are places to get help to do that. It wasn't your fault. It was never your fault. And it was never your shame to carry, ever.
Well, thank you so much, Lisa, for all the valuable information that you shared today. And thank you to all of our viewers that joined in and asked questions. And if you did not during this live program, if you're watching the recording by this moment, and you did not get an opportunity to join us live, please continue to ask questions in our chat or even on our YouTube channel. We will definitely do our best to make sure that any questions are emailed over to Lisa to be answered. And if you want to review any of those resources, find out more how you could volunteer and become a resource for Our Kids Center, please visit www.ourkidscenter.com. And you can find them on most, if not every, social media platform, as well as Our Kids Team.
Yes, again, thank you to everyone who joined us today for this very special Wellness Wednesday event. And especially you, Lisa, for shining a light on Our Kids and the incredible work you and everybody at Our Kids does to provide the expert medical evaluations in crisis counseling in response to child sexual assault.
Thank y'all for having us.
Have a great day, everyone.
All right. Bye.